It is far from an easy subject for parents to discuss with their kids. I myself had to have a conversation with my daughter when she got home from school, and now what we're talking about has happened in our backyard. 3 students killed, 8 others injured when a gunman opens fire at Oxford High School. Joining us this morning with advice on how parents can talk with their kids about this senseless tragedy, Dr. Tamina Shakir, a clinical psychologist, child psychiatrist, that is, with Wayne State. Good morning, doctor. How are you?
Good morning. I'm good.
So how do we talk to our kids in the wake of a tragedy of this magnitude?
Um, it really depends on the age of the child. Children respond differently to traumatic events, especially something tragic like what happened yesterday at Oxford, because school, as an institution, children connect that with safety. So, depending on the age of the child, we respond according to that. So, children who are younger may respond differently, but children who are in high school would respond differently. So, younger children tend to get clingy, they get very anxious, worried. They may regress. So they may start, behaving in a way that they normally won't, yelling, screaming, or getting very worried and scared, having difficulty sleeping at night, not eating properly. Those are all normal, expected reactions to a traumatic event like this. Um, High school kids, they may either get irritable, and they may sometimes even get rude at home, or especially to their parents, and or they may just stay in their room. They may isolate and just want to deal um, with the trauma by being by themselves.
So
I
how do
think the
we,
most
I'm sorry,
important
doctor,
thing,
how do we keep the
yeah,
lines of
go ahead.
communication open without
Yes,
being, nagging, being overbearing
yes.
about it?
Yes, I think that the most important thing is to have that line of communication open with our children, so that they can come at any time and come and talk to you. Um, when children start communicating, whether it is with their friends, with their parents, or with their teachers, other adults in their lives, um, they start processing what happened. They start making sense of uh, what happened and the fact that they are themselves safe. So the most important thing is helping them understand that if they are feeling a certain way,
Hmm.
especially if they're feeling fearful, anxious, or not like themselves, that's normal, and that encourage them to come and talk, encourage them to communicate,
Very
give
important.
words to their thoughts.
Dr. Shakir,
Um,
we're unfortunately we're out of time, but we really thank you for getting up this morning and sharing your advice with
mhm.
us. We'll certainly take it to
Okay,
heart with our kids. Thank you very
I
much.
appreciate. Good to be here.
We appreciate you as well.